Okay, good morning, students. So today we will be having a revisions on this nephrotic syndrome. So I'll be showing you all the slide. So can you see the slide?
Yes, ma'am.
Okay.
Yes, ma'am.
Yes.
Yes.
Okay, nephrotic syndrome. Okay. So those who haven't like written yet, you can just write down the heading, that is nephrotic syndrome. I hope every one of you have notes, but still, and check the spelling nicely. Okay. Okay, let's move on. First of all, let us discuss about the introductions of nephrotic syndrome. So the term nephrotic syndrome, okay, it is coined from the two Greek words. That is, nephros in Greek, it is known as kidney, and syndrome means it is a group of symptoms. So try to know this too. So let me repeat once again. The term nephrotic syndrome, it is coined from two words, okay? From two words, different. Nephro and syndrome is different. So nephro in Greek, the meaning is kidney, and the syndrome, the meaning is the group of symptoms. So are you done? You understand the introduction? How
Yes,
did the
ma'am.
term nephrotic syndrome derive? You understand?
Yes,
Yes.
ma'am.
Okay, let's move on. Let's move to the this definition. So the definition is nephrotic syndrome is defined as a primarily glomerular disease, okay, which is characterized by, so we will be discussing one by one how what are the characteristic features. So what you should know is that nephrotic syndrome, it is a disease, okay. It is a primary glomerular disease. Remember this, it is a primary glomerular disease, okay, which is characterized by, let us see one by one, which is characterized by high level of protein. That is, the other name of protein is albumin. See the spelling nicely. The other name of protein is albumin. That is high level of protein, that is albumin, are present in the urine, okay? And if the high level of protein are present in the urine, we can call it as proteinuria. So that was the first characteristic features. So this is the definition, okay, like you can write it down in one line also, like which is characterized by high level of protein in the urine, give comma, and then all this you write in one line. But I have just given you all like step by step so that you will be more clear. So this is the first point. So are you clear with the first point, high level of protein?
Yes, ma'am.
Okay, let's move on to the next point. There will be a low level of protein in blood. So if low level of protein in blood, then it is known as hypoalbuminemia. So this is low level of protein in the blood. So, and the next is there will be increased level of lipid. So if there is increased level of lipid, then it is termed as hyperlipidemia. And if there will be low level of lipid, then it will be called as hypolipidemia. So the next is there will be swelling of the body parts, that is called edema. So these are the like characteristic feature, okay. All these feature represent that a person can have nephrotic syndrome. So when you consider like the definition of like nephrotic syndrome, then you have to mainly like indicate all these points. So all these 4 points which I have given indicate that a person have nephrotic syndrome. So let us repeat once again. अगर किसी इंसान का नेफ्रोटिक सिंड्रोम हुआ तो लाइक नेफ्रोटिक सिंड्रोम क्या है? नेफ्रोटिक सिंड्रोम एक ग्लोमेरुलर डिजीज है, हाँ, जो लाइक उसका ये सब कैरेक्टरिस्टिक फीचर होता है. सबसे पहले क्या होगा, प्रोटीन, देयर विल हाई लेवल ऑफ प्रोटीन, जो यूरिन में बहुत ज्यादा प्रोटीन होगा, और प्रोटीन का दूसरा नाम है एल्बुमिन. एंड देन अगर हमारा यूरिन में बहुत ज्यादा प्रोटीन हुआ, प्रेजेंट हुआ, तो उसको बोलते हैं प्रोटीन्यूरिया. और अगर हमारा ब्लड पे बहुत कम प्रोटीन है, understand, हमारा blood पे बहुत कम protein है, then that is known as hypoalbuminemia. And then अगर there will be increased level of lipid, then it is hyperlipidemia. And अगर हमारा शरीर पे कहीं जगह पे कहीं parts पे अगर हमारा शरीर फूल गया, शरीर फूल जाते हैं, तो that is known as edema. Those who find difficulty in understanding in the English, then that explanation was for them. So all of you understand this definition?
Yes, ma'am.
Yes,
All of
ma'am.
you? All of you?
Yes, ma'am.
Yes, ma'am.
Okay,
Yes, ma'am.
okay, then let us not repeat. Okay, at the end I will be asking you all this. Today I will be surely asking this definition. All of you get ready, because sometimes you used to get confused. Now, in this place of high level of protein, you used to write a low level of protein. Sometimes in low level of protein, in blood, you used to write high level of protein in blood. So all this, don't get confused. Increase, decrease. Just what you need to know is that which one is increasing, which one is decreasing. So if it is decreasing, if it is increasing or decreasing, then where it is increasing, where it is decreasing, in blood or in urine. So don't get confused between the blood and the urine. So okay, let's move on. Next is nephrotic syndrome. It can affect the all age group. So this nephrotic syndrome, like it is not that it will affect only children, or it will affect only the advanced age. Advanced age means those who are old age, all those people. It's not like that, okay? It can affect all type of age group. It might be an adult or it might be an advanced age. So in children, it is most common, okay, from the age of 2 to 6 years. So this one, try to know from which age group in children nephrotic syndrome is mainly common. So from the age group of 2 to 6 years. Okay, so this is also very important. So males are slightly more likely to affect than female. That means as compared to that of the female, the male are like more susceptible to get infections of this nephrotic syndrome. माने मेल में ये नेफ्रोटिक सिंड्रोम, ये जो डिजीज है, मेल को अफेक्ट करने के लिए लाइक बहुत ज्यादा चांसेस है एज कंपेयर टू फीमेल. So are you clear about this? About this point, the red point, the blue point, everything you understand?
Yes, ma'am.
All of you? Okay,
Ma'am.
okay. Okay, let's move on. So the next point is the causes. So let us discuss one by one the causes. So many diseases, okay, many diseases and conditions can cause glomerular damage, okay, that can cause glomerular damage and lead to nephrotic syndrome including. Because why it is written that many disease and condition can cause glomerular damage? Why this mainly glomerular is mentioned? What was the definition of nephrotic syndrome? First line. Malvina, what was the first line of the definition?
Ma'am, it is a primary glomerular disease.
Yes, because nephrotic syndrome is a primarily glomerular disease. It's not it. So that is why like mainly we will focus on those. So many disease and condition can cause glomerular disease. So we will mainly focus on those kind of diseases that mainly damage our glomerular, okay? So if they damage our glomerular, then what happened? That can lead to nephrotic syndrome. So let us discuss one by one. What are the causes? So this is the one of the most common disease. That is, common disease means it's not that much common. So that is systemic lupus erythematous. So if you have written any spelling mistake, so you can just check here. Systemic lupus erythematous. And how to write also, like don't write all together like systemic lupus erythematous, all these don't write together. So how I have written in the slide like this, you have to mention. So systemic lupus erythematous, this is the first main causes. So what is lupus? Lupus, we know that it is a disease that can affect multiple organs of the body. So lupus ऐसा disease है जो हमारा ऑर्गन को अफेक्ट करता है, बहुत सारा ऑर्गन को एक साथ पे अफेक्ट करता है. तो lupus is a disease that can affect multiple organs of the body. So it can affect your liver, it can affect your heart, it can affect your lung, everything like together. It can affect your kidney. So everything it can affect. Okay, it is a disease that can affect multiple organ of the body, including the kidney. So that is what lupus is about. So nephrotic syndrome is common in people with severe lupus. जो जिसका lupus है, जिसका lupus disease है, माने जिसका multiple organ जो damage होता है ना, like for them this to develop this nephrotic syndrome, it is very common. It means that like this particular this systematic lupus erythematosus, this is the name of the disease. Okay, so those people who have like multiple organs disorder, okay, with severe lupus, okay, with severe lupus means severely like many multiple organ are damaged. So all those people, all those patients are much more like susceptible, okay, much more like prone to develop this infection, that is nephrotic syndrome. So that is all about the first point. So coming to the next is the heart failure. Heart failure. So I would like to talk about heart failure. Okay, little bit. Heart failure means like there are some form of heart failures. Okay, there are some forms of heart failure. What example will I take? Let me take an example of a constrictive pericarditis. Okay, there is a heart failure. There are some forms of heart failure such as constrictive pericarditis, and there are also like there can also be a severe right heart failure. Okay, right side of the heart, right heart failure. All these failure can cause nephrotic syndrome. That means if there is a constrictive pericarditis, or if there is severe right heart failure, then all this can cause nephrotic syndrome. So okay, that was the second causes. And the next is some of the like, are you clear with number 1 and 2 point?
Yes, ma'am.
Yes,
Okay.
ma'am.
Okay, let's discuss the second point. Let's discuss the third point. I mean the medical condition that can damage kidney. What are the medical condition, okay, that can damage our kidney? So certain diseases and condition increases the risk of developing nephrotic syndrome. Obviously certain disease, bahut sara, like any kind of disease, okay, all those certain disease and any other conditions that can increase the risk of developing nephrotic syndrome. So what are those medical conditions or any kind of disease that can increase nephrotic syndrome, that can increase the risk of developing nephrotic syndrome? Those are diabetes. अगर किसी का diabetes mellitus हुआ तो everywhere you will see this diabetes, because diabetes is very much, you know, like very much common to these common causes to develop any kind of kidney disease. So that is why हमेशा कुछ भी causes या कुछ भी वो मिलने से kidney disease कुछ भी problem मिलने से you always get this diabetes. So such as diabetes, again lupus, which I already like discussed, lupus, and the other one is amyloidosis. So I already explained the meaning of amyloidosis and other kidney disease. So what was amyloidosis? What was amyloidosis?
An abnormal protein buildup.
Say loudly, one of you say loudly. Say. I'm waiting. Say, what is amyloid?
An abnormal protein buildup.
Okay. So like, okay. So amyloid means, what to say, like this amyloidosis, okay, this amyloidosis, this is the disorder, okay, this kind of disorder, okay, it can occur when substances called amyloid protein, okay, that will accumulate in organs, in any part of the organs. So simply let me explain again. Amyloidosis, this is a disorder, okay, that can occur when substances called amyloid protein, okay, accumulate in organs. So like an amyloid are like a protein that can be deposited in the liver, in the kidney, in the spleen, or else in the other tissue in certain diseases. So what Srijana said was correct, okay? Okay, so let's move on to other point, that is number 4. So there are also certain those were the certain disease, okay, that can cause the risks of developing nephrotic syndrome. These are the name of the disease, and these are the name of the certain medications that can cause nephrotic syndrome. So what are those medicine that can cause nephrotic syndrome? That are non-steroidal anti-inflammatory drugs. Okay, in short, we call it as NSAID. Those who have written any spelling mistake, you check your copy. Non-steroidal anti-inflammatory drug, that is NSAID. Write it down, and if you haven't written this one, the abbreviation, then you can write down. Done? Non-steroidal.
Yes, ma'am.
All of you?
Yes, ma'am.
Can anyone tell me what are the example of non-steroidal anti-inflammatory drug? Any one of you? You have any idea? Like, because the non-steroidal anti-inflammatory drug, okay, these are the drugs, okay, if you take, then there will be like great chances of like developing nephrotic syndrome. So that means to take medication is good, though. Then of course, if overdose is taken, or else like beyond prescription is taken, then that can cause. So like, can anyone tell me the example of non-steroidal anti-inflammatory drug? Anyone have any idea? Have you heard the drug name ibuprofen? In our normal life, we heard this paracetamol, all this we heard, isn't it? All those common drugs and all those amoxicillin, omeprazole, all this we heard. So have you ever heard the name of the drug ibuprofen? Ibuprofen. Have you heard? Or have you heard the most common drug, that is diclofenac or diclofenac? You can pronounce it anyhow you like. Have you heard? Diclofenac or diclofenac. Have you heard this drug, the name of this drug? Any one of you? Anyone?
No, ma'am.
No, ma'am.
At least diclofenac you did not heard. It's okay, no problem. You can just write down in bracket if you want to know for future what are the non-steroidal anti-inflammatory drug. Write down ibuprofen. There are so many, but you just write down one or two. Ibuprofen. And the other one, if you want to write, you can write down. Give comma and write down DICLOFENAC. DICLOFENAC. Finish?
Yes, ma'am.
So not means like this non-steroidal anti-inflammatory drug. Okay, what does this drug they mainly do? This under this non-steroidal anti-inflammatory drug. Okay, so many drugs are there. So what does all these drugs do? This class of drug, they mainly reduces our pain. They decreases our fever. Okay, and they can also like decreases if there is any inflammation and all. That is why it is known as anti-inflammatory drugs. So these type of drug, they decreases our any inflammations that occurs, and then they can also like decreases, it means reduce the pain, and they can also decrease the fever, and even they can prevent the blood clot. Okay, if blood clot is, what was the blood clot? What was the other name of blood clot? Srijana, what was the other name of blood clot?
Ma'am, thrombophlebitis.
Yes. Okay. Okay. Good. So all those also now, when blood clots occur, all those also they can prevent. So these non-steroidal anti-inflammatory drugs is very much like very much important. Okay, because हमारा शरीर पे जब pain होते हैं तो doctor mainly prescribe all those things. So there are many drugs, you know, that comes under this, which might be common. Means you all might know all those drugs, but the only thing is that you don't know that that particular drugs come under this non-steroidal inflammatory drug. So now I would like to give you a homework. Is paracetamol and non-steroidal anti-inflammatory drug? Write it down. Is paracetamol non-steroidal anti-inflammatory drug? Finish?
Yes, ma'am.
Okay, let's move on. If anyone asks you what is non-steroidal anti-inflammatory drug, can you explain the meaning to that person? Yes or no? अगर किसी ने पूछा कि what is non-steroidal anti-inflammatory drug, so now will you have the capability to explain the meaning of this to that person who asks you? Yes or no?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, to whom will I ask? Is Surajit joining the class?
Yes, ma'am.
Okay, Surajit बोलो तो ये non-steroidal inflammatory drug क्या है? I'm not asking the drug, okay? मैंने सिर्फ पूछा कि ये क्या है?
इन इन्फेक्शन के लिए ये दिया जाता है.
Inflammation. मैंने क्या चीज, क्या बीमारी को like decrease करता है? Ilasara, would you like to help Surajit?
Yes, ma'am.
Okay. Please tell me, if someone asks you what is NSAID drug, so what will you explain to that person?
These are the drugs that are used to reduce pain,
Yes.
decrease fever, and
Yes.
inflammation.
Okay, decrease inflammation, and then it can also prevent
Fight infection. It reduce pain.
Okay, and what about blood clot?
Yes, ma'am.
Yes. Okay, very good. Surajit, you heard that what Ilasara explained?
Yes.
Surajit, okay,
Yes,
okay.
ma'am.
Listen carefully, okay? Okay, so okay, let's move on. And then like any drug that are used to fight infection. So when non-steroidal inflammatory drugs is given to the patient, okay, and if excess amount of non-steroidal inflammatory drugs is given, then that can also like cause nephrotic syndrome. And not only non-steroidal inflammatory drug, there are also certain drugs that used to fight infection, and understand, drug that used to fight infection. So if any kind of drugs are given that are used to fight infection, those drugs can also cause nephrotic syndrome. So that is the number 4 point. So let's move on to the next. Certain infections. So not only this certain disease, certain medication, there are also certain infections, okay, that can cause nephrotic syndrome. So what are those infections that can let a person develop nephrotic syndrome? So Example of infection that increase the risk of nephrotic syndrome include HIV. So अगर किसी का HIV हुआ तो उसका nephrotic syndrome होने का chances है. तो what is HIV? Offline में भी मैंने सिखाया था. HIV का full form क्या था? Don't tell me you don't know. Okay, wait. Let me ask. Finisha, can you please tell me what is HIV? Finisha? Finisha is absent. Okay, Rifan, what is HIV? Miss Rifan, what is HIV?
Yes, ma'am.
What is the full form of HIV?
Human immunodeficiency virus.
Yes, very good. Okay, HIV, H stand for human, I stand for immunodeficiency, and V for virus. So it's human immunodeficiency virus. So whoever don't know the meaning yet, you please write it down. So what is HIV? What is HIV? HIV means it is a virus, okay, that mainly like attack our cells that help the body to fight infections. That is the meaning of HIV. And then hepatitis B, I already explained, okay? Srijana, please take attendance. And hepatitis B, I already explained. And then hepatitis C and malaria. So what was hepatitis B? Hepatitis B?
Infection of liver.
Yeah, say loudly, say loudly.
Infection of liver.
Yes, very good. Hepatitis B means it is a serious liver infection, okay? Means there will be infection in the liver and that will be caused by the virus known as hepatitis B. Okay, then what was hepatitis C? Hepatitis C? Hepatitis C, this is also an infection, okay, that is caused by a virus, okay. This also will like affect our liver and it ultimately led to like inflammation. So that is also hepatitis C. And malaria, so I don't need to explain, everyone know what is malaria, isn't it? Any one of you want to explain what is malaria? Trishna, do you want to explain what is malaria? What is malaria, Trishna? Srijana, what is malaria?
Malaria is a disease caused by mosquito.
Is caused by what?
Plasmodium.
Yes, Plasmodium parasite, okay? Like it, how does it get transmitted? Very common. You studied in community. How does malaria get transmitted? Any one of you know?
By the bite of
Yes, by the bite
animals.
of mosquito. Okay, so, and then what was the next point? Next is chronic glomerulonephritis. So because of chronic glomerulonephritis, a person can have nephrotic syndrome. And the last but not the least is renal vein thrombosis. So thrombosis means blood clot. So chronic glomerulonephritis, like no need to explain. I think you all know what is glomerulonephritis, is not it? Meaning number explained earlier, so no need to repeat. Glomerulonephritis, you know the meaning, right? Yes, inflammation of the glomeruli, that is known as the glomerulonephritis. So chronic means like slowly and steadily the disease is like rapidly, like gradually, like increasing slowly and steadily. So all those are the causes. All these causes can then can lead to can let a person suffer from nephrotic syndrome. So are you clear till the causes, everything? Systemic, heart failure, medical conditions, certain medication, certain infection, all this. Are you clear with this?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, so let us like revise, okay? Whatever we have discussed from the beginning. That means there will be no more time for this discussing about the questions. No problem. From Monday, we will continue with the remaining part of nephrotic syndrome. And if the time remains, then I would like to discuss with you all the questions. I have already given 40 questions, right?
Yes, ma'am.
Okay,
Yes,
I
ma'am.
think I have 2 class on Wednesday, right? Wednesday. So let us do one thing. In Wednesday. I will try to in one class I will take the questions, only the questions, and in the other class I will explain. Is it okay?
Okay, ma'am.
Okay, ma'am.
Okay, so nephrotic syndrome. So nephrotic syndrome, what was the nephrotic syndrome? So no need to, it was coined by the 2 words, okay? One was nephro, the meaning was kidney, and one is syndrome. Syndrome ka matlab group of symptoms. So, and the other is definition. So definition mein kya mila? Nephrotic syndrome is, it is a primarily glomerular disease, okay, which is mainly characterized by high level of protein in the urine, that is proteinuria. And if you simply write proteinuria, then also the answer is correct. So low level of protein in the blood, and then increased level of lipid and swelling of body parts. So I thought of asking, but time is very less. So okay, next is nephrotic syndrome. It can affect all age group, okay? Whether it's like in the adult or in the advanced age, it can affect everyone. But as even though it can affect all the age group, but mainly in children, it is common. So from the age group of 2 to 6 years, it is very, very common. So, and then here, males are slightly more male are slightly more likely to be affected than female. तो यहाँ पे मेल लोगों का ज्यादा nephrotic syndrome disease affect होने के लिए ज्यादा chances है male. But in urinary tract infection, what we get, female are more like susceptible to develop this infection, right? That UTI. Okay, what is the next? The next is the causes. So now we have discussed many causes. That was systemic lupus erythematosus. What is lupus? I already explained. Heart failure, all those examples also heart failure. I have give certain heart failure now, that is constrictive pericarditis. And if there is a severe like right heart failure, then all those can cause nephrotic syndrome. And then certain medical conditions, जैसे कि certain disease, अगर किसी का diabetes हुआ, and if a person have lupus, suffer from lupus, amyloidosis, all these things, and any other kind of kidney disease, whether it is acute renal, chronic renal, any kind of kidney disease can cause nephrotic syndrome. And then the other one is certain medication. So I have explained the medication very nicely, and I have given you all homework. That homework show me on Monday. That is paracetamol, non-steroidal anti-inflammatory drug, all this. So NSAID are the drug that can cause nephrotic syndrome. And if a certain drugs that can fight infections, all those drugs can also cause a person develop this nephrotic syndrome. And the other one is certain infections, that is HIV. I already explained the meaning. Hepatitis B, what organ does it mainly affect? All those I mainly explained. Liver. And hepatitis C, I explained. Malaria, every one of you know. And then that was all about the certain infection that can cause nephrotic syndrome. The other is chronic glomerulonephritis. So as we know that all these nephrotic syndrome, it is mainly caused because of some glomerular damage. So obviously if there is chronic glomerulonephritis, that means if there is inflammation in the glomeruli, then that can also cause nephrotic syndrome, which is very common. Then the other one is renal vein thrombosis. In the renal vein, that is in the kidney vein, in the kidney there are lots of vein. If there is a blood clot in the kidney vein, then that can also cause nephrotic syndrome. So all of you are clear till here?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Okay, if you have any
Yes,
confusion,
ma'am.
because in one day I don't want to discuss so many things, because you will have puzzle, now you will get confusion. So let us discuss a little so that you can like memorize it. So do you want to ask any questions? Anything? Only 1 minute left. Any question you want to ask? Srijana, are you done with attendance?
Yes, ma'am.
Okay, okay. Anyone want to ask question? Hurry up, hurry up. If you, yes, just tell me yes or no. If no, we'll end the class.
No, ma'am. No, ma'am.
Okay, okay. Okay, then that's all for today. Okay, thank you, everyone.
Thank you,
Thank
ma'am.
you.
Thank you, ma'am.